I'm Larry Kaplan. I'm a general internist at Temple, the Lewis Katz School of Medicine at Temple University, where I see patients and I have a myriad of different roles in the educational shop. We practice, in a group practice with the medicine residents as well as the general medicine faculty. There is often a, hey, can you look at this rash? Or, hey, have you ever heard this before? Take a listen. So it's kind of always entertaining, always engaging. When I think of doctor, I could not think of one disease. I actually thought about infectious diseases when I went into residency, and my ID mentor, a wonderful woman who passed away a few years ago, would always ask me, why do you want to ask them about things other than their tropical medicine illness? And it's because I find that interesting. And she goes, did they ever think about general medicine? And I was actually the only person in my residency class who went into general medicine, just because general medicine was not something that was really popular in the, it was subspecialty medicine in the 80s. But no, I love what I do. Realize that you're going to have to work really hard and obviously study, but figuring out how you learn in the best way for you to learn, be it a visual learner or auditory learner. Do you learn by going to lectures? Because if you don't learn by going to lectures, then you should not be going to lectures and wasting your time. It is the proverbial drinking from a fire hose and the aphorism of, half of what we tell you will be completely irrelevant in 7 years. We just can't tell you which half. As someone who grew up in the pre-HIV era, I had to learn lots of things after medical school and residency. Figuring out how you learn, figuring out how you're going to kind of continually educate yourself. And then that's important. But probably the most important is figuring out what makes you happy and having some balance in your life. Because if you don't have balance, and that could be art, musical instrument, exercise, reading, conversation, food, whatever works, if you don't have balance, you're going to be an incredibly cranky physician. And if you're a cranky physician, you're not going to be able to take care of patients. And that's why people end up burnt out. And I'm not saying that's the perfect recipe for preventing burnout, because the system as we currently have it doesn't provide you enough control to say, I don't want to see patients every 20 minutes. I want to take a half an hour and I'll work an hour longer in the day or whatever, because I want to give more time to my patients. That control we don't necessarily have, but control is one part of it. But figuring out what makes you happy and figuring out some way to keep doing that as you go through training. You get to kind of evolve and do lots of different things. And the beauty behind medicine is, you can kind of adopt. You can become, an expert in a particular area.